good morning. It really should be more of a conversation, this, rather than a talk, isn't it? And I wish I was in amongst you in a nice round circle, but I'm not. And so I'll make it a little talk, and we'll see if it morphs into a conversation. It's clearly important to start with Karl Marx, who said in his familiar quotation in 1845, what is written up there? Philosophers have only interpreted the world, the point is to change it. While interpretation is clearly important, and I'll spend a short time doing just that, really I share the sentiment in the quotation that what we need to do is to change things, and change things for the better, and change things so that people's health is greatly improved on what it presently is. So over the next 20 minutes, I'll explain how an international framework of carbon entitlement, or based on carbon entitlement, best exemplified by the framework of contraction and convergence promoted by the Global Commons Institute, offers us an opportunity for beneficial change. It's an opportunity to tackle climate change in a way which promotes good health, and so has at its root some synergistic benefit. And it's an opportunity to create the environment in which beneficial policies can flourish. And I'll talk a little bit about the many wonderful, wondrous local projects which don't flourish very well because their environment isn't particularly beneficial. But to start with, if we're going to improve people's health through carbon entitlement, I guess we ought to know what actually is the best possible circumstances for promoting good health. And do I point this at something in particular to make it go forward? Or?
Press an arrow.
I have.
You press the wrong one.
I don't think so. Oh yeah. I'm pressing away, but maybe not pressing hard enough.
Sometimes takes time. Yeah.
Well, anyway, what makes for healthy societies? Oh, there we are. What makes for healthy societies is that, of course, all people have to have access to and fair shares of economic and social resources, crucially education, and the planet's really constrained environmental resources. That's an essential prerequisite for a healthy society. And, of course, the important thing about this, in terms of climate change and the problems we face, is that such societies inevitably involve the transition to zero population growth, as I'll show a bit later on, perhaps. Of course, these societies have to be created within the services and resources being delivered to us by our planet, so within our environmental limits. And the best way of describing such a society, and I'm not going to spend too much time on it now, is to call it a fair shares society. One in which there's a fair shares of social, financial and environmental resource. Fair being less rather than more rather than less equal, I should say, distribution of resource. This fair shares world is seriously undermined, as all of us in this room know, and two of the key things which undermine it are, of course, global climate change and the perils that it really proves and shows, particularly for people in poor countries, and the gross and completely unethically unethical and unsustainable distribution of resource, maldistribution of resource between the rich and the poor. Examples of this are well known to you, actually, I guess, and I'll just put them up here because you all know these things which are a scar on our society. And perhaps this is the particularly one which causes particular angst to me, is this gross disparity in resources and income between peoples. And of course that's not only in poor countries, but it exists in rich countries as well, as you know. And the personal income perhaps is a very good marker of this gap which is so counterproductive to health. And you can see here how the ratios of global incomes have moved in the wrong direction over the last years and are still moving in the wrong directions. So we have a problem of, we have knowledge about how we create a fair shares healthy society. We know what the problems are, we know the disparity problems, we know that this is further aggravated by climate change, and these are some of the ways in which climate change impacts on the health of peoples and actually is an additive to the disparity which exists and is so bad for their health. We know, and I'm sure that Robin, I'm afraid I wasn't here to hear what he said, I'm sure he has gone over these particular ways and methods whereby climate change impacts on the good rain, the possibility of good health. Oh, right, well, here they are, some of them anyway. And I'm sure that will be talked further about at later dates too. And perhaps the most important component here is this last statement, the demographic and social and economic dislocation, which is going to be an inevitable consequence of the changes we have, is of course immensely counterproductive for good health. So we have a situation where we know what we need to do to create good health. We know what some of the problems are which are making this a very difficult situation. And why should health professionals in particular be responsible and involved with this? Because that's a question that I'm often asked as a health professional. And probably many of you don't know that the GMC gives doctors duties, which are really part of our ethics and indeed are part of the regulations which we are guided by. The first is completely unexceptional and well known to everybody, and I'm not going to spend any time on it. I hope that any of you who've had the benefit or disbenefit of going to our health services have felt that you are treated in the ways that's outlined here. The second is the more important, because we have an obligation to ensure that our society is health creating. And so we do have an obligation to try and make a society that I've talked about, and therefore to tackle the problems which actually are making it so difficult to get there. And the important thing to recognise in this kind is that there are many projects which actually have climate change and health benefits which are in place already in many places of the world, and that actually what's good for the climate is good for health. And so responding to climate change is not a distraction from the business of public health. It's central to it. So we know what we should be doing, we know what the problems are, we know that as health professionals we have an obligation, and I would say that that obligation actually is carried through society, but from a particular health perspective we do have an ethical obligation written into our codes. And what I want to just show now, before I talk about how carbon entitlement might advance the cause, is just to give an example of some of the projects which are around the place which actually do have these synergistic benefits of giving social, environmental and economic gain in a synergistic way. There are lots of them, and I've just chosen a few here to exemplify what we are talking about, and they come from some interesting places. You'll see here that in Germany, because of the feed-in tariff, essentially, there's been an explosion in renewable energies, and look at those jobs which have been created, look at the euros that have been generated, and look at the tons of CO2 saved. Each of those has, of course, health benefit. And it's very easy to articulate what that is and to quantify it in the lack of use of the healthcare resources and the productivity which comes from people who are not ill. Africa, many of you know that Wangari Maathai was awarded the Nobel Peace Prize for her work, and you'll see that through her inspiration, Kenyan women have been involved in planting these indigenous trees, and of course that's only the beginning of it. it's emancipated the women, they've become much more active agents in their whole life and created extraordinary benefits to local communities and their good health. M&S, Plan A, many of you know about Plan A. M&S have committed themselves to achieving a large number of sustainable objectives, and they're really quite well done on the way of doing it, and they have shown that it's saved them large quantities of money, that it's actually improved the attitudes and views of people who work there for, and therefore the productivity, and that of course in itself has health benefits. Some of these haven't been quantified properly, but many of them we know from other studies are going to help people's health. Just a couple more before I talk about carbon entitlements directly. Iran, often considered to be an evil empire by some, has had the most remarkable demographic transition, which is happened in merely 20 years, basically. And you can see here that it's quite feasible for the demographic transition to stable populations to happen very quickly, provided the right policies are in place, and these policies are clearly health promoting and financially beneficial as well. And finally, just because I'm a bicyclist, it's important to recognise that actually at a personal level there are some wonderful policies which I'd actually call, many of us have called virtuous cycle policies. These are the ones we're talking about here, which have synergistic environmental, social and economic gain, and this is a very simple example of how really a pretty trivial bicycle ride, 5 kilometres each way, has enormous benefit over a year, and and of course it's more than 50 minutes of exercise you take, but if you only take 50 minutes of exercise a day, there's quite clear other collateral evidence that you get a major increase in life expectancy. So, just to kind of encapsulate all that, we know how you can create health-promoting societies. We know what the problems which actually cause this to be more rather than less difficult are. We know that there are interesting policies in place which actually do give the necessary pointers to what can be in place if we want to have such a society. The question is, why aren't these policies in place all over the world or at all times? It's clear, if you think of the examples that I talked about, that these are usually put in place by enlightened and committed people against the trend of what is the economic ethic of the age. It's not done consistent with many of the policies which are in place now. And so my proposal is, and the proposal of many is, that if we put in place a system of carbon entitlement and allocate that in a fair shares way, this can provide the necessary framework for driving such virtuous cycle policies. And so I'm going to spend a little time, my last little time, explaining what such a framework might be and how it might be put in place. First, I need to do a little bit of carbon literacy. And I usually hear, why not with this nice small audience, I usually hear just ask a question. How many of you here know what your own individual carbon emission responsibility is? One. Any more? Okay, well I think you're negligent. I think that if you know what your bank balance is, and don't ask me what mine is actually, I'll be negligent, but if you know what your bank balance is, you should know what your carbon balance is. This is a key bit of information which you have to know. And, I've forgotten that. Exercise is highly effective as an antidepressant. So if any of you are feeling a bit, as I am, blue because of the dreadful 2 weeks we've had here without seeing the sun, just go and exercise and you'll be fine. This is a bit of the carbon literacy that you have to know before you can understand the virtues of carbon entitlements. These are rough and ready figures. They're not absolutely accurate because they have they're contested in some respects. and I'll point out one respect they're contested in a minute. But essentially, and this is carbon dioxide, incidentally, not carbon. Those of you who are scientists will recognise, well, even if you're not scientists, will recognise that there are two figures often put forward. One which is carbon, and the other is carbon dioxide. You have to multiply one by 3.18, I think, I've forgotten the figures exactly, to get from one to the other. This is carbon dioxide emissions. And you'll see that the front runners, in terms of this particular graph of the USA, actually, Qatar, I think is presently at 70 tonnes per person. So it is quite impressive. But they're a small country, and so I haven't put them in this little graph. But you can see that the USA are 20, the UK and most of Europe are 10, but that, of course, there's an important caveat with that. Those 10 tonnes are those which are generated by activities within the UK. As we've exported most of our manufacturing to China, we, of course, have put some of our burden onto the Chinese, whom, as you can see, they're a big population, but they have an individual per capita emission of only 5 tonnes. And India, which is also sometimes castigated as being terrible, as you can see there, has a small carbon footprint as well. And the most important thing in the context of what I'm just about to say is Africa. Sub-Saharan Africa, carbon emission per person is very low indeed. So there's a very wide trajectory of carbon emissions. And the proposition which contraction and convergence and carbon entitlements put forward is as follows. And most of this is pretty self-evident, and why it hasn't been put in place is a question of political will and all of us not getting our act together and pushing it, but that's a separate issue at one level. We need to set a carbon budget, and that needs to be set to ensure that we keep the carbon dioxide concentrations below an agreed level. Now, clearly there's contention about that level, and that would be in itself a big argument, but let us say, for the sake of this particular audience, 400 parts per million of carbon dioxide equivalent. It's quite easy to calculate that on the back of an envelope, given the knowledge we have now about carbon emissions and the other greenhouse gas emissions. So you set a carbon budget. And then, if you're lucky, you reduce this over an agreed period of time to a level which is that which the Earth can cope with. Now, assuming a population of 7 billion, and I know that's an unfair presumption, but let's go along that for the moment, that is about 1.4 tonnes of carbon per person per year. So we have a long journey. We're 10. We've got to get to 1.4. The Americans are 20, the Qataris are 80, whatever it is, 70. So all of us have got quite a long journey to get to a sustainable level. And of course, there's one key issue: we need to protect the carbon sinks, because if we don't, that level and the carbon budget will be even less than it is now. And so any policy framework has to take into account changes for protecting the carbon sinks. This is called the contraction part of this particular policy, and you can see why, because by contracting the amount of carbon emitted in this frame way, we will help stabilise atmospheric CO2 levels. So that's the carbon budget. What we then need to do is to allocate an equal entitlement to this budget to all citizens, all adult citizens. This is the convergence part of this particular framework. And we can remove rapidly to an equal entitlement. The rate of movement is, of course, going to be dependent on negotiation again, but a more rapid rather than less rapid movement is important in terms of equity. And so you get, finally, a convergence of Earth's bounties and support systems as manifest by the carbon emission. And and this is the key bit really, the frugal emitters, usually the poor, will be able to sell their unused entitlements to the profitable emitters, us. And for compelling financial reasons, all will invest in low carbon initiatives. Us because we don't want to have to buy carbon, and the poor because the carbon they have to sell they don't want to use in a way which actually reduces their subsequent income. So this will drive the low carbon economies that we're looking for. And given that each tonne of CO2 entitlement will have a substantial financial value, and this is where carbon pricing, of course, is really important too, this process will enable a framework-based market transfer of money to the poor. And the key thing is, for once, if this system gets put in place properly, the poor will be in control. They will have the power to determine what they do with and who they sell to their carbon entitlement. So it has the makings of a very effective framework for delivering climate justice and social justice, both of them key to promoting good health. And I'm just going to finish off by saying what I think this would do for our health, because contraction and convergence, I talked about virtuous cycle policies, and of course it is a global virtuous cycle policy, and it would encourage and enable small-scale local activity, as I said, for obvious reasons. Somebody talked about the solar panels in China. I mean, the carbon load of that is extensive. If you had to pay for that, you might well find that it's much cheaper to make them even in expensive Britain. And so this framework creates a virtuous cycle at a global level, as I say, which enables these other virtuous cycles at many other levels to take place and flourish. It provides the right environment for many projects and policies which are already in place to flourish and to get to scale. And I think that's self-evident, it facilitates these at all at the national, regional level. And this unleashing of the worldwide boom in low-carbon local production and consumption cycles is, of course, as you'll remember if you go back to what I was trying to say about health, key to people's good health and the promotion of good health in society. So you can articulate the health benefits of contraction and convergence very simply, and this is kind of to keep our cool is obviously important, and something which we all try and do, even when we're confronted with Nigel Lawson. And those arising from the narrowing of the gaps, so narrowing the gap between the rich and the poor. And just as I can't have the time here to go into it in detail, but Jeffrey Sachs has said that the development of the Millennium Goals is essential to the health and well-being of Africa. This particular type of financial transfer would more than on an annual, regular basis provide the money necessary to attain all the Millennium Goals in Africa very quickly. And that would transform the situation for that country. I'm going to finish off by saying this policy of contraction and convergence and carbon entitlement for health is something which has been developed by the Global Common Institute, but which is very widely promoted by many health professionals, and the organisation which I co-chair, this one is in the forefront of promoting it, and if you want to know anything further about either the organisation or this, that's the website. So thanks very much everyone. I hope I'm now persuaded that carbon entitlement is the way forward, and it offers us a really optimistic and positive way to try and resolve what is usually seen as an insurmountable problem. So thanks.
Thank you, Robin. Would you like to
Yeah.
take a few questions? I'm sure there will be some. Do we have some questions for Robin? Yes, Bob.
Yeah, Bob Wall from the Grantham Research Institute. Let me start by endorsing your overall message. It's very clear that unmitigated climate change poses huge potential risks to human health across the world. But I would also commend the work of Nicholas Stern on this issue of entitlement. From an ethical point of view, it doesn't work in the sense that greenhouse gas emissions are a form of pollution, and the atmosphere is a global commons. There is no entitlement to pollute a global commons. So the idea of an entitlement to pollute the global commons just doesn't work. Secondly, your entitlement only looks forward, it doesn't look back. And if you're talking about equity, you have to take into account historical emissions, on which basis for the rich countries we currently have an entitlement of 0 emissions. So another way of looking at this is, and it's another important point, you need to think about all greenhouse gases, not just carbon dioxide. If you add all the greenhouse gas emissions together, we're currently emitting about 50 billion tonnes of greenhouse gases a year. And the current composition in the atmosphere is about 435 parts per million. So we're about probably 5 or 6 years away from getting to 450. We don't want stabilisation. We'll have to come down below 450. To have a 50-50 chance of avoiding a rise in global average temperature of 2 degrees, of more than 2 degrees, we need to get down to about less than 20 billion tonnes a year by 2050. And that sets really your target for per capita emissions. So we're at 50 billion tonnes at the moment, population of 7 billion, we're talking about 7 tonnes per capita. By 2050, projections suggest we'll be at 9 billion, and we need to be below 20 billion tonnes. That means, on average, 2 tonnes per capita is what we need just to have a 50-50 chance of going above 2 degrees. And I think that does very clearly point out where we need to get, because as you said, I think current UK emissions are about 8.8 tonnes per capita. The Americans are well over 20. Qatar, host of the next UNFCCC, are also very high. And China is around about 6 or 7 and rising. So I think it is very clear that you need to look at per capita emissions. I would balk at the idea of an entitlement because it's polluting the global commons, but we do have to be realistic about the fact that everybody needs to get down, because when you get to about 2 tonnes per head, you can't have too many people above that average, because you're not going to be able to get much below 2 tonnes per head in the world in 2050.
Well, I think you largely endorsed what I said, actually, and I agree with virtually everything you said. We have to get down to those 2 tonnes. The reason I use entitlements is actually interesting. I didn't used to use it. I used to use rationing, and that became such an aversive, had such an aversive effect on everyone I spoke to that I tried to find a different word. And so, but this is clearly carbon rationing. I mean, and if one wants to call it that, then that's what one would call it. But actually, and just to go back to the other very important point you made, which is historical responsibility. Of course, this does not incorporate historical responsibility. Again, I'm a health professional, I'm a pragmatist, I'd love to incorporate historical responsibility. If we did that, we would be -2 now. And that's actually unfeasible. It just ain't going to work. And I'm also a great fan of Nelson Mandela. And he coined the phrase, if you like, justice without vengeance. And exemplified this in the extraordinary transition of South Africa in the early 90s. And I consider contraction and convergence the first step in a process. And I haven't got time here to talk about it. It's the first step in a process which must be put in place before we can begin taking into account all the other very important issues we talk about. And I consider contraction and convergence justice without vengeance, because the vengeance bit of it is what we did over the last 100 years. And it is vengeance, because if that was put into place, we would all now be at -2 or -3 tonnes. So I think that all your points are really well taken. I think that my view is, as a pragmatist, and I don't like calling myself that in a way, but that's actually where I come to be, that as a pragmatist one has to do what one can, and this move towards a carbon ration entitlement is a first step in this journey.
Sorry.
Thank you. Judith Stevenson from UCL. And thanks very much for that talk. I enjoyed it. The contraction and convergence concept's been around for a few years, and it's one can endorse it for all the reasons you've given. That's never mind this backlog. I just wanted to ask you how much progress you think has been achieved, because it's a big ask for most of the world, especially the high limiters, and
Of course, what you say is completely true. It has been around, and actually was more acceptable to most people in the early and middle 90s than it is now, for obvious reasons. There was more scope, more room, more aptitude then for doing this. It is a big ask. I think the only way that we can make that big ask tangible is by showing that there are economic, social and health benefits to the small-scale projects and the middle-scale projects which would be unleashed by such a framework. I'm not optimistic, to be truthful. It's terrible to say at the age of 70, isn't it? But I'm not optimistic, to be truthful, that this is going to be something that's put into place quickly. But what I do think is that unless we, as an engaged and committed populace, say that any ask to tackle climate change is a big ask, any ask, and if you can't find a better ask, then you have to have this one. And so what I would say to people who say it's a big ask is, okay, what's the other ask? Where is another ask which does this? And I haven't heard too many asks. I've heard of lots of projects locally which actually have these benefits, and they're wonderful and wondrous and they're exciting and great. But they are scattered, isolated, not mainstream, and somehow the ask has got to do that. So it's a big ask, but what's the alternative?
You've said that the entitlement should be per head of population.
Adult, sorry, I shouldn't say.
So
Adult population.
Adult population. Okay. So that puts everybody on an equal footing, which is not a huge ask, it's a massive ask. What about having carbon entitlement by country according to their GDP?
No.
Do you think that would work?
There have been other suggestions, and there may be some tweaking necessary, but the carbon entitlement, according to their GDP, would not drive equity. And the key issue in here is equity, to me. As a health professional, it's quite clear that inequitable societies are radically unhealthy, and we have to get to a better position of equity if we want to promote good health. So anything which diverts from the equity issue is a problem for me. But again, Robin, I'm intrigued by your saying it's a big ask, because everything you ask is a very big ask. And you know, when people say it's a big ask, I get back to them. Well, what is the option? What are asks are going to make this work? Because we got to make it work.
Oh, sorry. Would you like to have a supplementary?
Can I just respond to that? It wasn't so much that I've got a better alternative up my sleeve, but rather just in quite a naive way thinking about what are the steps required to achieve that. I mean, you've got to have global agreement, really, haven't you? You can't have one or two major countries deciding to opt out of that. And is it through? Is it going to happen through things like Rio +20 and the MDGs after 2015? How is that actually going to happen? The people who really have to make decisions.
Well, thanks, Judith. There is obviously quite a groundswell of support for CNC, which I haven't had time to talk about. And if you go on to and I'm sorry, this is rather a bad way of putting it. If you go onto the GCI site, you'll see that the countries and people who have espoused this as a possibility. Much of the problem is not the concept. Much of the problem is the political will. And I have a solution to that, which I'll give you. I think in Qatar, which is a dreadful place to have any conference in my view, or anything else, that nobody going to that conference should be over the age of 50, half the people should be under the age of 25, and half should be women. And if you did that, and didn't put anything else on the agenda, my bet is that they'd get there. Given the present negotiators, and I feel very bad now because I'm clearly not in that particular bracket, but nor you, no, but given the present negotiators, I think that we have a slim chance. But there are China, for instance, has intimated through their, I've forgotten which particular official, that they would be interested, provided that the move to convergence is negotiable. Because one of the sticking points is that the West wants to delay convergence, West, rich country, the big emitters want to delay convergence, and the small emitters want to advance convergence. And when this was put forward in Copenhagen as a possibility, the rate of convergence was stipulated by the big emitters, which pissed off the small emitters no end, quite reasonably. So it has to be a negotiable path to convergence. So there are a number of things which are important. A negotiable path to convergence, getting the right people into negotiation, and I think then, crucially, examples of projects which work in this way at grassroots level, which we have to collect, and that's what I was trying to show a few examples of.
Interested, I see the equity and the beauty of your suggestion. It's very neat and so on. But
Practically, I should say.
Okay, this suggestion. Practically, how would it work? How would you measure and enforce in a rich country how much carbon one uses every time one switches on the television set or gets in one's car? Equally, if you go to rural India, how do you measure that person's carbon and then make the transfer?
Of course, that is a key issue. My response to that is twofold. One, I'm a doctor. There are thousands of civil servants who are supposed to be able to do these things, and why the hell don't they do it? And they've got the talent and ability to do it. But that's rather a frivolous response. The second is that actually the smart card technology now is advancing at pace. And as you know from your experience in India, and I know from my experience in Africa, everybody's got a mobile phone. Well, everybody's got mobile phones. Everybody's got smart card technology. There probably will be stages in this. The money will be allocated to national level first, and it may well be that chunks of the emissions are taken out by the amount of energy that the country generates, or whatever. So there are stages in the implementation. I don't have an answer to your question, but I think that the advance of technology, particularly smart technology and mobile phone technology, widely available, is part of the solution. And there are lots of brains out there, and in a way I would like to feel that the people who presently work on God knows what should be doing some better work on this kind of thing. And I appreciate it's an unsatisfactory answer, and I don't have a good answer, but I think that technology is part of it.
It is unsatisfactory. Technology and bureaucracy is not going to solve this problem of point of use. So why not just price carbon?
Pricing carbon is, in my view, pricing carbon is, well, of course you do price each ton of carbon dioxide. It has a price, it has a value. But pricing carbon is potentially, not potentially, actually regressive, because the people who would be most hurt are the poor. So if you price carbon, you'd have to have a way of addressing the regressive problem, which again would be bureaucracy, and again would require a lot of technological hassle. And so my response to you is pricing carbon has as many problems as trying to do this. And neither of them are straightforward. And I think that many people have to go away and think about how to make this work. And with new technology, I think that makes it much easier than it would have done even 10 years ago.
You've had one as well. Rachel, did you want to ask a question? Paul?
Yeah, on this point of carbon pricing, I would be careful about regressive. Remember, the reason for pricing carbon is because if you don't, at the moment, it's a form of pollution which is subsidised, and the costs of that pollution are imposed on other people who have to deal with the impacts of climate change. And the poor pay the biggest.
Yeah.
So all that happens is by putting the price on climate change, putting the price on carbon, you move that cost off the people who suffer the impact onto the people who emit. So it's actually a good way of dealing with this problem from an economic point of view. The question of affordability of energy is a different question. It is not a question of the right to pollute. It's about access to affordable energy. And I think that what happens is when you price carbon, other forms of energy that do not emit greenhouse gases are look properly competitive with fossil fuels, which are at the moment unrealistically cheap because you don't pay for the costs of the pollution. And that's the principle. So far from being regressive, I think it's actually about making the polluter pay. That's what the carbon price does.
Of course, carbon emissions would do exactly that too. Entitlement to carbon emissions promote the need to, first of all, conserve energy, which is by far the most important thing we can do, and second, to generate locally renewable energy. So, I mean, I think this is the kind of debate that we should be having in terms of policy. We should forget about what the hassles are, because we know them. It seems to me now all of us should be actually engaging in vigorous debate about the ways forward and how they can be. And I'm not here to say that contraction and convergence is the only way forward. I'm here to put it forward as a very thought-provoking and sensible way of looking at things. And I think we should be talking about whether pricing carbon is better, whether upstream pricing is better, whether contraction and convergence is better. There are enough, but that's where we should be at. Not saying, you know, God help us, the Greenland ice thing is going to go into the water tomorrow afternoon. Because, I mean, we have to move into a solution. You know, Marx was right. We have to change things. We've got to change them, and quickly.